Hi friends, today we going to discuss about the homeopathic beautiful medicine called Bryonia. Mainly, Bryonia is a wonderful medicine we can use repeatedly in the clinical practice. Whenever we ask about the complaints of the patient, we come to know this is Bryonia, this is maybe aconite, this may be a belladonna. How we come to know that? After listening to the complaints, these complaints, this belonging to this remedy. How we can know about that? Now means you can ask about the how complaints are comes. Okay, we can see in aconite the complaints come with a violence. In belladonna the complaints come with a suddenness. Okay, whenever complaints come suddenly, in a belladonna the complaints come suddenly and go suddenly. But in a Bryonia, what happens? In Bryonia, the complaints are comes gradually. Okay, there is a insidious onset. It is the persistent remedy. Okay, understand? It is a persistent remedy. All the complaints will develop slowly and have an insidious beginning, like gelsemium. Gelsemium also there is a complaints insidious beginning. There is a complaint starts suddenly, not suddenly. Complaints start slowly. Okay, they develop slowly. For example, if whenever we expose her to the cold, okay, we expose her to cold, what happens in a aconite or maybe in a belladonna? If we expose her to cold, the symptoms appear suddenly in hours. Okay, after exposure in hours, the complaint starts. But in a Bryonia, after the one day, the complaint starts. Okay, understand how we differentiate from aconite, belladonna and Bryonia and gelsemium. Okay, most commonly the Bryonia is a heart patient. Okay, we already know that heart patient means all the complaints are aggravated by the warm conditions. Okay, whenever we see the patient of belladonna, all the complaints are aggravated with the motion. Whatever may be the complaints, okay, whatever the complaint, the complaints are aggravated by the motion. If you see, there is a inflammation of anything. Okay, there is a gastroenteritis, there may be a peritonitis, there may be inflammation of the bowels. If they, and even also there is a inflammation of the joints, whether the joints there is a rheumatic complaints or not, whether they may be exposed to the cold or not, but if they are aggravated with the motion, it is a clear indication that it is a Bryonia. We should think of the Bryonia. Whenever the symptoms are aggravated by the motion, it is the strongest feature of the Bryonia. Whatever may be the complaint, it may be the inflammation of the organs, inflammation of the mucous membrane, inflammation of the serous membrane, whatever the complaint, the complaints are aggravated with the motion. Understand? Aggravated with the motion, then really there is a strong, we can think of the Bryonia. The beautiful characteristic of the Bryonia is whenever in the mucous membrane, what happens? Bryonia produces dryness. Okay, understand? In the mucous membrane, Bryonia produces dryness. But in a serous membrane, Bryonia what do in a serous membrane? They produce a fluid formation. Understand? It may be the membrane of the brain, maybe extended to the cord. There may be the pleural membrane. It may be the peritoneum. It may be the heart covering. Like the serous membrane, what happens in the abdominal covering peritoneum? What happens? There may be the peritonitis. Okay, in the chest membrane pleura, there is a collection of fluid in that. There may be the pleural effusion, there may be the pleurisity. Understand, this is the characteristic features of the bryonia. Whenever they affecting the mucous membrane, they produce dryness. But whenever they affecting the serous membrane, they produce there is a collection of fluid. You should understand that future. Okay. After that, whenever we see for example, if your mucous membrane is dry, for example, lips, mouth, nose, respiratory tract, alimentary tract, okay, there is a dryness of the mucous membrane. Due to the dryness, there is a increased thirst. Okay, there is a increased thirst, but patient there is a increased thirst for large quantity of cold water at large interval of time. Understand, large quantity of water at a large interval of time. But arsenic album, what happens? Increasable thirst, cold, little quantity of water at a little interval of time, short quantity of water at a short interval of time. Understand? Small quantity of water at a short interval of time in the arsenic album. But here bryonia, large quantity of water at a large interval of time. Okay, another characteristic feature of bryonia is there is a stitching type of pain. This is another characteristic feature of the bryonia. Okay, one is the all complaints are aggravated with the motion. Next, there is a stitching type of pain. And another, this is a heart patient. Another, there is an increased thirst due to the dryness of mucous membrane. How it be the thirst? There is a large quantity of water at a large interval of time. Understand? This is a characteristic features of the bryonia. You can differentiate it from the aconite and it will be differentiated from belladonna. The complaints, how the complaint starts in bryonia? The complaint develop slowly and have an insidious beginning. This is what bryonia. Understand? This is what bryonia. Understand? Another characteristic features of the bryonia is lying on the painful side ameliorate the complaints. Understand? Lying on the painful side ameliorate the complaints. The bryonia is a right-sided remedy. Understand? Bryonia is a right-sided remedy. Okay, we can differentiate it from the phosphorus. How means? The phosphorus is a left-sided remedy. Bryonia is a right-sided remedy. You know, bryonia is lying on the painful side ameliorate the complaints. In phosphorus, lying on the right side ameliorate the complaints. Both we can indicate written in the respiratory complaints. Both we can indicate in the respiratory complaints. It's most commonly indicated in the respiratory complaint. There is a stitching type of pain in the chest. Understand? There is a stitching type of pain in the chest. Okay, most commonly we can indicate the bryonia in pneumonia. Okay, in the early stage of pneumonia we can indicate the bryonia. Okay, most commonly left lobe of the right lung is most affected. In bryonia what happen? Lower lobe of the right lung is affected. In the most common remedies are lycopodium, chelidonium and colicarb. In this drugs, lower lobe of the right lung is most affected. There is a stitching type of pain. You know, another peculiar symptoms of the bryonia is patient holds the chest while coughing. Okay, patient hold the chest while coughing, and also patient have desire to take a deep breath. Understand? Patient hold the chest and patient want deep breathe. This is another peculiar symptoms of the bryonia. We already know that the bryonia complaints are aggravated by motion. Okay, entering into the warm room because it is a heart patient, understand, and deep inspiration, and ameliorated by the rest and lying on the painful side, understand, lying on the painful side ameliorate the complaints. This is the characteristic features of the bryonia, understand. Because of their whenever we want to indicate for the respiratory symptoms, for example, the patient is exposure to the cold. Okay, after exposure to the cold, what happens? There is a loss of voice, hoarseness of the voice and rawness of the trachea and soreness in the chest. Okay, after exposed to the cold, what happens? There is a harshness of the voice as the loss of the voice and the rawness in the trachea and the soreness in the chest. Next, there is a dry hacking cough, like if chest would burst from coughing, understand. Like whenever we expose to the cold, the bryonia patient, what happens? First, mainly there is a loss of voice and rawness in the trachea and soreness in the chest, understand. Then what happens? There is a dry hacking cough. Dry hacking cough. You should know the cause of the respiratory complaints. Whenever there is a exposure to the cold, okay, whenever taking the cold, or maybe getting in a hot summer, or maybe the exposure to the cold wine, this may be the cause in the cough of the bryonia. Understand, most commonly, right side is most commonly involved in bryonia, and chest there is a stitching type of pain, and there is also patient while cupping they hold the chest, they support the chest, and patient want deep breathe. This is bryonia. These are the characteristic symptoms of the bryonia. Whenever you see the patient with a stitching type of pain, okay, lying on the painful side, am I right? You should think of the bryonia. If there is a heart patient, understand, all the complaints are aggravated by the motion. This is a bryonia. You should understand the bryonia like this. These are the most characteristic symptoms. Whenever you find the symptoms in the case, you should thought of the bryonia. Okay, you should thought of the bryonia. Okay. The another characteristics features of the bryonia in the mind complaints is patient always talk about the business. Okay, they always have a dreams of business. Why? The patient of bryonia always have a dreams of business, always talk about the business in a pure condition also. In the delirium, patient is talking about the business, and also patient want to go to home even though he is in the home. Why? Because the bryonia is a patient having a feeling that they have lost something. In their life. They have some feeling that they want to earn. How? By doing business. They want to earn this by doing business. What we need for business? What we need for business? We need business for money. The bryonia patient always take a risk. They invest all their money. Understand? They invest all the money in their business. That's why they fear that if a business will fail, what happens? Fear of failure in the business. That's why the patient is always thinking about the business, because they invested in all the money in there. That's why the patient always think of the business. And also patient has desire to go home even though patient is in the home. Okay, another feature of the Another main symptoms of the Bryonia is, okay, another feature of the Bryonia is, see, for example, patient desire for something, understand, patient desire for something, when you offer them they refuse that. Okay, this is the characteristic features of the Bryonia. Okay, for example, child carried by the nurse, understand, child is carried by the nurse. If you go to the child and if you want the one, okay, you get a toy. For example, you go to the child, okay, you go to the child, what child wants, even you also want that. Then what happens? Then what happens? He does not want it, the child does not want it, and throws you to the face, throws it back to you. Understand, this is also be seen in the creosote and chamomilla. Understand, these are symptoms are may see in the staphysagria also. Okay, yet finally, the summarizing the topic, Bryonia. Whenever you see the Bryonia patient, understand, you always think that first one is the complaint starts not suddenly, they start insidiously, they have grow not rapidly. Understand, they slowly develop. Okay, understand, first complaints is they develop slowly, one complaint. Second, the all complaints are aggravated by the motion. Third, the Bryonia is a heart patient. Fourth, there is a dryness of mucous membrane and collection of the fluid in the serous membrane. And sixth, lying on the painful side, amelioration. And next, there is a stitching type of pain. Okay, these are they always think about the business, they have dreams of business. Even though patients there in the home, they want to go home. Okay, these are the characteristic features of the Bryonia. Okay, the complaints are always continuous and remittent. Okay, the complaints of Bryonia are, they always, the remittent, not intermittent, most of the times. Like this, you understand the Bryonia. Okay, in next class we can discuss the another drug. Thank you.